Well, welcome to another episode of Insurance Gone Wild. I am your host, Dennis Settlemoir. This is our lovely co-host,
Stephanie Lencioni.
I always let her introduce herself because she always makes fun of me for repeating her name, Stephanie Lencioni.
Yes.
So anyway.
I didn't know if you were going to say lovely co-host today. I thought you were just going to be like, and this is... I'm like, I got demoted somehow.
You got demoted.
I'm no longer lovely.
Well yeah. There are so many things going through my head right now.
I was like,
I can't light on one of them.
We'll move on from that then. But
and the hubby's here, so
I know. Yeah, that's fine.
And he may agree with most of it. He may agree with some of it. Probably most of it.
You know, he
won't say it to you, but he might say it to me.
I don't think so, pal.
Oh, I'm thinking.
I don't think so, pal. I don't even know where you're going with that, but I'm going to say maybe.
Okay. All right. Well, hey, we are going to talk. We've got, this is August. In the next August.
2 months.
We're in August right now. The next couple of months is going to be open enrollment for a product that we have not spoken about before. Or if we have, we've hit on it very quickly and moved on. And that is Medicare. Medicare. We also do Medicare. And so I think we're just going to start right off the top with this. What is the difference between Medicare and Medicaid? There is a difference.
There's absolutely a difference. So Medicare has to do with typically age, right? Now you can get on Medicare. So it's usually when you're 65, you become eligible for Medicare. There are situations where you can become eligible for Medicare prior to 65. Quite honestly, we're not going to get into the weeds about that, but just think of Medicare is for your wiser and mature clients, right? 65 plus. Medicaid is for anybody of all ages. You can even be on Medicaid and Medicare, but Medicaid is, it's based on financial status. So if you need financial help for medical insurance and medical insurance purposes, Medicaid is the system, the organization, the process that comes in for that. So you'll get a lot of pregnant women can be on Medicaid, right? And then usually once they give birth, they can get kicked off. It kind of just depends on the situation. And then children can get on Medicaid. So when people go through healthcare.gov, and we've talked about this before, and I don't want to get too in the weeds, but we have with that subsidy that people can get through healthcare.gov, and I feel like you're twitching, and I need you to calm it down because I'm sensing the energy. And quite honestly, Dennis, I don't like it today. You're going to have to cut that out.
Yeah, health insurance is tough for me.
I know, it's going to be a tough episode for you. But
yeah.
So essentially, though, so again, healthcare.gov. Yeah. Thank you. Better energy. You've got your floor and your ceiling for where you fall for a tax credit, and which is basically like the discount for insurance. The top means the ceiling is you've made too much money. You don't qualify for any tax credit discount. The floor is where they say, hey, you don't qualify. You don't make enough money. You need to reach out to a Medicaid office to see if you're eligible that way. And that's the reason they have that floor is because we already have this program in place to say, hey, for the people who fall in this bucket, this program already exists. So healthcare.gov is filling a different need, and then Medicaid is filling a separate need. Does that make sense? So that's the difference. So Medicaid could be for all ages, and Medicare is on a very simple basis, 65 and up.
Okay.
And there are exceptions, like being disabled and different things.
Yeah, you could be disabled and be on Medicaid.
You can be on Medicaid. Yep. Same thing, though.
It's very confusing, right?
It does. And there are rules. And again, not getting in the weeds. So just think again, Medicare is for parents, grandparents. Medicaid can be anybody.
Sure.
And income related specifically.
So, okay. So specifically about Medicare, let's talk just a little bit about that today. And I know there's a lot of rules around what we can say and what we can talk about, what we can't talk about when it comes to Medicare, governmental rules.
Yep.
Mostly. But so let's just talk about some very, very basics. We've got Medicare.
See, Happens to the best of us.
Medicare supplements, and we have Medicare Advantage.
Yes.
And I'm talking as somebody who's very ignorant because this is not much. I don't know hardly anything about this. What is the difference between supplements and Advantage?
So you know what I'm going to do? I'm going to back you up a little bit.
Okay.
I am going to answer that question.
Okay.
But I do want to back us up a little bit, and I do want to give the foundation of Medicare. So for people watching, you have what's called, because everyone's like, well, is it plan? So it's Part A, Part B, Part C, you can hear, and then Part D. Okay, those are the parts that you hear. But then you can hear like, oh, well, it's Plan F or Plan G or Plan N. So just like typical insurance, they make it really easy for people to follow.
Yeah, right.
Yeah. So we're going to back up, just talk about original Medicare, just to simplify. So we're talking, and so you have turned 65. Automatically, the government is going to enroll you if you qualify, which means you have worked 40 quarters in the United States. Okay, 40 eligible working quarters automatically qualifies you for Part A, no cost, no premium, nothing. That is your hospital. So Medicare, you can still be working, you can have other insurance, whatever the case is. Part A is in effect automatically. You do nothing for it to happen. Part B, you have to enroll in. Sometimes, I mean, I have heard of people who get automatically enrolled in it, and that can actually be a really negative thing. Part B for Medicare, and these A and B are both completely through the government. So it has nothing, I can't set you up with it. No other broker can set you up with it. You have to go to, like, it's my ssn.gov or something, right? But Social Security Administration is who does this. And then you have a premium associated with Part B, and that is your like medical coverage. So it's your doctor's appointments, it's your labs, it's everything other than hospital, right? Related to medical. So don't think dental, don't think vision, don't think that kind of stuff. Does that make sense? Are you following?
No, I got it.
Okay. So those are the two. That's what's called original Medicare. Those together, if you have them both, they're covering 80%. Well, and each of them cover 80% of each bucket that they're addressing, right? So if you just have Part A, it's going to cover any hospital bill you've got. It's going to cover 80% of that. And then you have the remaining gap of 20%.
All right. So if we had a $50,000 bill because I was in the hospital for a few days for whatever it may be. Well,
it covers 40,000 and you're still on the hook for this remaining 10,000.
Correct. But what if that 10,000, what if some of that 50,000 is labs and stuff like that? Then it all gets splits up between the different buckets, right?
Then it gets split up between the different buckets. So if you don't have Part B and you have no other insurance, then you're on the hook for 100% of that.
Yeah. So, but you always have Part A.
But again, we don't do medical billing. This is just like, if the hospital thing, it may be different, that I'm not entirely sure. Again, I don't do the billing portion of it. But basically any sort of follow-up that you would have with a specialist in their office, that would be your Part B situation, right? Okay, where were we going with that? And then we're going to skip and we're going to go Part D. Part D are your prescriptions. And this is, so this is important because, you can wait on B and D and without a penalty if you have what's called creditable coverage. So it needs to be coverage that is considered by the government, like, yes, this is legitimate coverage. You have medical insurance, or you've got coverage in this, and then, yes, you've got adequate prescription coverage. If you are not enrolled in such a plan, and you have with Part D over 63 days of not having Part D, you will then get penalized financially. There will be an additional financial penalty by the time you do enroll.
Part D is for drugs, correct?
I'll call them prescriptions. It's not that kind of podcast, Dennis, but yes, it is.
So prescription drugs is Part D.
Yep. Because we get a lot of clients that are like, well, I don't take any prescriptions, so I don't want to pay for that.
Yeah.
I'm like, I hear you. And I hear you. Just understand, again, we're not here to make the decision for you. We're just here to tell you what's going on. Mm-hmm. But as you get older, eventually, prescriptions are usually a thing that become a part of a person's life if they are lucky enough to reach older age. Mm-hmm.
I'm already on them, so that's all right.
Yeah. But at that point, whenever you do enroll, they just need to know that there's going to be a penalty, and there's a whole formula, and we're not getting in the weeds with that stuff. But it gets added on to the cost of a prescription drug plan based on how long they were uninsured.
So let me back up here just so I understand. Let's say their birthday is October 1st. They qualified October 1st. They're on Part A and B.
Well, I got to cut you off, though.
November
if your
1st?
birthday's October 1st, you actually qualify the month before. Okay. So it got dicey. I know, right? But we just have to be accurate. Medicare is like, we just have to be accurate.
All right. So that's fair.
Yeah. October 15th, birthday, middle, second through the end of the month.
So they have 63 days to get to buy Part D, or they have penalized?
When they decide to get a Part D plan. So they don't get penalized in the process, because they have to then get if they don't get the plan for 10 years, that's totally fine. They're not penalized until they've had 10 years of not being insured. And then the calculation gets hit on the 10-year mark. But yes, and that's assuming, because a lot of people are working longer than 65. You've got some that retire a little bit earlier and all the things, but some people still are holding full-time jobs and they've got benefits through work until they're 70. Well, that's totally fine. So when they get on Medicare at 70 and do, your Part B and then your Part D and there's no penalty. As long as they had creditable coverage during those 5 years, during their working time, then they're fine.
So you already got, I'll be honest with you. I have not, I can't keep up.
I know, it's a lot.
It's just.
And I'm no expert. But basics, right?
Yeah. No, I get it. I think the idea is that it's just very, very confusing. And
it's very confusing.
I mean, you've got it figured out. You say you're not an expert. You're an expert on it, but I understand why you were saying that. But the thing is, for somebody like me who just does not like health insurance the way the system is, and whenever we start talking about it, the vein in my forehead starts quivering a little bit, I'm lost. Yeah. And that's okay. I think you've done a good job explaining it. It's just that I have a mental block when it comes to this stuff.
For sure.
And, there's pieces of it I pick up, but I won't remember it tomorrow. And I think it goes back to as we get older, that starts happening to a lot, whether we want to admit it or not. We don't always want to admit it, because as I get older, I don't want to admit it, but I will joke that all the boxes that I file things, I think I said it this morning, it's like a little kid who's been in there playing around and stuff's everywhere.
Yeah, there's like a rubber duck in one file and you're like, what?
Yeah, exactly.
Yeah. Rubber chicken.
But I mean, okay, so we've got Medicare supplements, Part B, C, and D. What's Part C?
So Part C, this is where it gets confused. That feeds into your Medicare Advantage question versus supplement.
Okay, so that's where I was headed.
Yeah, so what's super confusing, and I just don't I kind of understand why they did it, but I really don't understand why they did it, because then they're like, wait, where's my Part C? I need Part C. Mm-hmm. Okay, so Part C is what's called, that's Medicare Advantage plans.
Okay.
That's that. It can either be strictly the medical plan that fills in that gap of the 20% that's left over from Parts A and B. Mm-hmm. And you can get some plans that have premiums and some that have no cost per month.
Okay.
And then they work very similarly to under 65 plans, where you have a network of doctors, whether it's HMO, POS, PPO, all of these things, HSA, you can have. And then deductibles, max out of pockets, copays, all of the things. But you can have, so 2 buckets in the Part C, where you can have just a Medicare Advantage plan. Again, just filling the 20% gap. or what's called an MAPD, which is Medicare Advantage Prescription Drug Plan.
I have seen that, yes.
Yes, and that is quite honestly the most common that we have seen within our agency and with other things, because it just bundles everything together. And then a lot of times you get where your Part D, you still don't have a premium. So you're not paying, because if you get a standalone Part D plan, for the most part, and there are actually some that do not, but most of the time there's a premium associated with it, a monthly cost. But you get an MAPD, there are plenty of $0 a month options out there, just varying, details and things like that.
How do they do that?
That is a different episode, and probably over way more drinks. Yeah, I don't know. Yeah. So again, it's the whole system and all the things. So you don't have to have a Part C, right? And we don't really. I'm going to tell you, I don't, and most of the brokers and agents that I know, we don't refer to it as Part C, but you'll find where clients will come and they're like, I need a Part C. We're like, okay, great. Let's talk about options.
You know what they're saying. Yeah,
we know what they're saying. It's at least, yes.
Because they read it on the Google.
Yeah. And I will say, when we're sitting down with clients, we usually like having a visual aid. I mean, for anybody, that's helpful. This is confusing stuff. It's not easy. And then don't even get me started on, we are not even going through all of the details of what a prescription drug plan does with like that.
You can't even do it on
you need a
traditional plan.
I know it's true. But, and so
Class A, Class B, Class C, or Level A, or whatever the number.
Tier 1,
Tier 1,
yeah.
Tier 1, Tier 2, Tier 3.
So the alternative to a Medicare Advantage is going to be a supplement, right? And they are called Medicare supplements. They are called gap plans. They are called supplemental gap plan. I mean, any variation, combination of all of those words, but it's basically your supplement. So the biggest difference between the two, usually, because you can find a Medicare Advantage plan that has a premium, but typically that's why people go with the MA plans. You have a pay now, which is your supplement, versus pay later. What I mean by that is the pay now is you're paying monthly. So you have a premium and you're going, and then usually the supplement is kind of filling, for the most part, filling those gaps for that 20% gap. And with some exceptions of, what you have to cover in addition to. So you have a little bit more that you have to come out of pocket first. You've got like a deductible and, but pay now, or with the Medicare Advantage, it's pay later because you don't have a monthly premium. So it's really just pay as you go. So if you go to the doctor for anything above and beyond your annual physical, you pay as you go. Does that make sense? Opposed to like, if you have this supplement and you never go to the doctor, you're still paying. But you typically are going to pay less if something big happens.
Sure. No, I get it. I get it. I remember we talked about this before. You and I have talked about it off camera, but I think we've talked about it on camera whenever I was thinking about doing the Medicare stuff.
I was like, God, no.
The AHIP and all that.
Yeah.
I'm like, how could the government take something and screw it up so bad?
They're really good at that.
Yeah, they
As I say that, I am not suicidal, and I'm a very excellent driver, so I will not have a single car accident.
Yeah.
Trying to protect myself on that.
They are.
I've got witnesses.
I just remember going through it. I wasn't even halfway through the first course, and there was how many courses? 7, 10 courses. I forget how many there are. I was halfway through the first course. There were so many acronyms. So many acronyms in the course that I took. Maybe it was a bad course. I don't know, but I'm like, this is crazy.
I mean, AHIP is AHIP is AHIP.
And that's when I called Stephanie up. I'm like, you want to partner on this stuff? Because I don't want to deal with it. And so that was, golly, 10, 15, 10, at least 10 years ago.
Oh, yeah, before we actually partnered.
Yeah, exactly.
We were just
I need a
partners.
health person. I can't.
Yeah.
I don't want to deal with this crap. Oh, it was Obamacare. During Obamacare, when it was coming out, we've talked about that, how it was changing 3 or 4 times a day for one thing. That's when I was studying for this, and I'm like, oh my gosh, this is crazy. that the government has got this messed up, this thing, that messed up. Now, it's a great program. That's not overall, despite what the government has done with it, it is still a good program. It's better than nothing.
It is absolutely better than nothing. You know what's so funny, though, is that I would maybe argue like 15 years ago, prior to Obamacare, people were like, oh, Medicare.
Yeah.
Dang it.
Yeah.
And now this is kind of actually genius by the old government here. And you're not going to hear me say that often. They have done such a poor job with under 65 coverage that people cannot wait
to get on Medicare.
On Medicare.
I get it.
They're like, oh my God, I have 3 years. I have to just make it through the next 3 years.
Yeah, I was getting ready to say that.
Garbage coverage. And then I have Medicare. I'm like, I tell you what, I didn't hear that 15 years ago. I didn't even hear that 10 years ago.
Yep.
And now people can't wait. So kudos, American government. Kudos.
Yeah. So we could talk about, we could, we're not going to, but I will say this and then I'll move on. We could talk about what the ACA, Obamacare, has done to the market. And I'm going to say my 2 cents and then I'm going to shut up. I think that Obamacare was a great idea. I think Obamacare was a very poor design and implementation. That's all I'm going to say about it, because I think it screwed things up worse than where they would have been. So, but the Medicare thing, you're right. I mean, I don't know how many people. Man, I got one more year. I turned 65. I'm on it.
But I'm telling you, did you hear those conversations 15 years ago?
Oh yeah.
No.
Yeah. It was different.
It was different. Yeah, different conversations. But they're like, Medicare. So it definitely has changed the narrative. I will say with ACA, I will say my 2 cents, and then we will back up. And this could be a whole thing, a whole episode, but it filled a need. There's with anything, there's good and there's bad. And we talked about this on one of the recent ones that we shot, but for every action, there's always an equal and opposite reaction, right? With change, there's always going to be somebody who gets left out. It can't be perfect for everybody. The concept of it, I truly believe the intent behind it was to implode the United States healthcare system.
I would agree with that.
That would be my 2 cents.
I think it was they wanted to ruin the healthcare system so they could get national health care. I'm not going to argue that good or bad. I'm just saying I think that was the plan for it.
I think that was the plan. When you are asking people to just sign it before reading it, how does that even align with our values and our no business owner would even do that, right? Business owner, let alone people who are running a country for millions upon millions of people. You know, just sign it. And this is literally the conversation. Just sign it, and then we'll read it later. Oh, and here's kudos to that little hoe bag. Then they did.
Yeah,
they just signed it. Now, don't get me wrong. Again, it provided coverage for people. I think most of these programs, on the surface, that the new programs and government programs that get established, I think. Well, I would hope, because I don't know, intentions are everything. But I would hope that on the surface, the intentions are to help a class of people, right? A people in a certain group and whatever. But then I think what inevitably happens with every program is it gets absolutely abused. And just like anything else, you got to audit it. Is this still necessary? Is this still aligning with the mission of what it was supposed to accomplish? I mean, we kind of had the conversation just with our business where you were like, hey, here's our mission statement. Here are our value statement.
It's such a political hot potato.
Yeah, I know. But I'm just saying, like, everything just needs to, it's not a problem to reevaluate.
Yeah.
So in a nutshell, you have your original Medicare. See how I did that? Like bringing it on back. Your original Medicare, Part A, Part B. Part A, if you have worked 40 quarters in the United States, there is no cost. Part B, is usually associated with a premium, and that is based on income. So sometimes it can be lower. There's a standard, and sometimes it can be lower if you qualify, and then other times it can be higher. And they usually do a 2-year look back based on income.
Well, that's an interesting rule to know.
Mm-hmm. Yep. They usually, if that's still,
whenever I,
don't quote me on that, but I'm pretty sure they usually do a 2-year look back.
Yeah. Okay. All right. Anyway, go ahead.
Mm-hmm. So yeah, I mean, we have some clients that are paying a lot for Part B, a lot, because they're quite successful. So
they didn't plan.
I mean, they can swing it, so they're fine. But, and then beyond that, then you have your gap plan of whatever kind, whether it's Medicare Advantage or it's an actual gap/supplement plan, pay as you go or pay every month. And then you have your Part D, which sometimes, most of the time, will get funneled and built into your pay as you go plan, but has to be separate. It has to be a separate standalone when you do your supplement. And then there are penalties for not enrolling in certain timeframes. And then here's something else. Part B, the reason this was important. So if you are still working and you have coverage through your employer, and that's the coverage that you want to keep, first of all, I would sit down with somebody and say, hey, does it make more sense for me to look into Medicare options, or does it make more sense for me to stay on my employer plan? If it makes more sense for you to stay on your employer plan or spouse's plan or whatever the case is, do not, let me rephrase that. I would recommend not enrolling in Part B. Number one, there's no reason to pay an additional premium. And number two, it starts a clock, and that's the guaranteed insurability clock. You have 6 months. If you are looking to enroll in a supplement, you have 6 months from your either being 65 or your Part B effective date to enroll in a guaranteed insured supplement plan, which means you could have stage 4 cancer, buy a supplement plan that covers everything with the exception of a small Part B deductible. And you're out for a couple $1,000s and everything's covered and no problem and and you're good to go. But if you miss that window, because you have to medically qualify for supplements. So I didn't talk about that before. You don't have to medically qualify for Medicare Advantage plans. You do have to medically qualify for supplements, which is, I mean, that can be a game changer. So again, there's really a lot, and I'm trying not to get too in the weeds to keep us safe. And I don't think I've said anything that would get us in trouble, but we'll definitely review this one. We may send this one off to get reviewed as well. But
I mean, we've run out of time. I think it's time for me to go outside and beat my head against the wall.
Yeah.
So
I mean, that's just fun to watch anyway.
Well, we are out of time. We are not way past our time, but we bumped up against it pretty good.
Yeah.
Give us a call, 817-753
0093.
0093. I forgot our number.
Ask for Dennis when having Medicare questions.
No, don't ask for me. Ask for Stephanie.
No.
If you have Medicare, or Lynette.
We have staff specifically for Medicare questions.
Correct.
Like
it's a Medicare question.
It is so specialized. It might as well be as different as commercial versus health. In general. It is a very specialized product.
Just say you have a question about Medicare.
We will send you to the right person.
We'll get you to the person.
Yeah.
Or you can email us, contact@igwpodcast.com. contact@igwpodcast.com. And we'd be glad to reach back out to you and answer any questions we can that way also. Thanks so much. Bye.